We're now going to move on to the debate. Thank you. On the report by the Health Committee, and I call Steve Brine to move.
Thank you very much, Mr. Deputy Speaker. Thanks for granting this debate. I beg to move the motion on the order paper in my name on the Government's response to our report on workforce and our initial report thereof. Today's debate, I suppose, couldn't come at a more timely moment, and when I wrote that line I didn't realise even more timely moment given the news that we had this lunchtime around the government accepting the pay review bodies across the public sector. And I said in this House earlier, I welcome that very much. I think it is a fair and a proportionate response on behalf of the whole economy and all taxpayers, which the government, of course, has to see it in the round. And I hope that all unions in the health space will show the same response that we've seen initially from the main teaching unions. And I would urge them to do that. So last week we marked the 75th anniversary, of course, of the NHS. And the week before that, the government published the much anticipated NHS long-term workforce plan. It was very much welcome. Some 46 organisations posted messages of support for it. So I think it landed well. So therefore, I think in the context of the last fortnight, it's a good moment to look back at what the Health and Social Care Select Committee, which I chair, recommended in our major report last year on workforce issues, but also to look forward to see how many of those recommendations have been taken up in the new workforce plan and what remains to be done. It also follows hot on the heels of our topical evidence session just yesterday, where we had some initial views about the plan from stakeholders, putting some of the already emerging questions to them and the Medical Director of NHS England, Professor Stephen Powis. And we're particularly grateful to the former doctor author Adam Kay for coming and speaking to us, and to Alex Whitfield, who is the Chief Executive of Hampshire Hospitals Foundation Trust, which runs the Royal Hampshire County Hospital in my constituency. So thank you to them for coming in. So the committee's workforce report, Mr. Deputy Speaker, was published nearly 12 months ago, at the end of July 2022. It was the result of a very wide-ranging and in-depth inquiry looking at workforce issues, including recruitment, training, retention across the health and the social care sectors. And I pay tribute to my right honourable friend, the member for South West Surrey, of course the current Chancellor of the Exchequer, for his work then chairing the committee and since. But as ever, we are as one, and I endorse every one of our report's findings. That's because it was the result of more than 150 written submissions, extensive range of oral evidence witnesses from across the health and the care sector that put together the report. And its main conclusions were stark. The report found that the NHS and social care sector is facing the greatest workforce crisis in its history. It noted that in September 21, the NHS was advertising just over 99,000 vacant posts, and for social care that figure was 105,000. Such a choice.
I thank the member for bringing this debate at such an important moment when waiting lists are, I think, at record levels, if the press are to be believed from today. But would he agree with me that we need urgently to have improvements in the way workforce from abroad are employed, and there are some really exploitative practices going on out there in certain care homes? Would he agree with me that that does need to be tackled urgently?
Well, anybody who is employed in health and care should be treated properly and treated with respect and welcomed to this country with thanks for the work that they're doing. I mean, if she's got specific examples of something, I'm guessing she may have from her intervention, then please do speak in the debate and put them on the record. I'll give way to the Honourable Lady.
I'm grateful to the Honourable Member for giving way, and I want to thank him for calling this debate and for doing the work on the report and to his committee. He notes the issues in social care are regrettably much worse than they have been before. He will know that on the 30th of June, 9 NHS leaders wrote to the Prime Minister calling for a workforce plan for social care. The Royal College of Nursing and others have called for it as well, including my party, the Liberal Democrats. I'm just wondering whether he, as chair of the committee or the committee as a whole, has a view on that. I know that the Health Secretary has said that the workforces are different, but I just wonder if the committee has a view. Thank you.
very much so, and we'll come on to it, but I'm happy to take it straight away. I mean, I think in getting the NHS workforce plan out, there were 4 people in that marriage. There was the number 10, number 11, the department, and of course NHS England. So I think the idea of producing another workforce plan for social care causes some degree of deep sigh. That said, it has to be done. And when I was at NHS Confed in Manchester last month, talking about our Integrated Care Systems inquiry, Patricia Hewitt, obviously the former Labour Health Secretary, and I were talking about all of these issues, and there was no question there was a huge response from the room in wanting to see a care plan alongside an NHS plan, and obviously the Care Minister is on the Treasury bench, so we'll hear this exchange. It is even more difficult than the NHS workforce plan because, of course, the vast majority of services in that sector are not delivered by the state. But just because something's difficult, I give you the 5 priorities, it doesn't mean they don't need doing. So yes. So I was just touching on the vacant posts, wasn't I? And but of course both these figures have got worse in the time since the report was published. We think there's some 112,000 or so vacant NHS posts in England in March of this year. Now the inquiry that led to our report found that almost every healthcare profession was facing shortages. And the impact of that workforce crisis, Mr Deputy Speaker, was also clear to see, with the report citing, for example, that the waiting list for hospital treatment had risen to a nearly 6.5 million in April last year, and that waiting list stood at 7.4 million by April this year. And I dare say the strike action in recent months, of course, hasn't helped, which is another reason why I reiterate in fact, I dare say I know it hasn't helped, and the figures speak for themselves, which is why I reiterate my call for them to know, as the Prime Minister's words this lunchtime, to know when to say yes to the pay offer that has been made as a final offer today. So the committee's report was critical of the government's reluctance to act decisively and noted that a workforce plan promised in spring 2022 still hadn't materialised at that time. It recommended in no uncertain terms that the government produced objective, transparent and independently audited plans with workforce projections covering the short, the medium and the long term. And the reason I stress audited is because the House will remember that the now Chancellor and I were among those who voted in favour of an independently audited workforce plan when the Health and Care Act went through this House. And it's credit to the Chancellor that he has driven that agenda through in government. And the National Audit Office, it was announced a couple of weeks ago, will now do that assessment. And we look forward and will support them in doing that work. And we as a Select Committee will obviously offer them any help that we can in doing that. But so that's what we called for, and obviously I'm delighted that the NHS Long-Term Workforce Plan was finally published at the end of last month, that it's here. It's no coincidence that happened once my predecessor entered the Treasury. I think it's a huge moment for the NHS, it's a big moment for patients, and I think it's a very good moment for patient safety, which I think lay at the heart of the current Chancellor wishing to drive this through. Of course, there are caveats, there always are with me. For example, the committee called for workforce plans for public health and social care, which is the exchange that I just had with the lady from St Albans. For what it's worth, I think, and I've said this in the House before, I think the government was right actually to resist the constant tedious calls from people, including me, to get on and publish the plan because I think in fact the most important thing was to get it right. And I've spoken about the 4 people, the 4 organisations in that marriage, and I don't underestimate how difficult that was to get this workforce plan out. And now it is out, we can scrutinise it, and part of what we're doing today, of course. But I know it takes time to get these things done, and I think it was right that the government took its time. But I would say that the plan is a real sign of hope, actually. I think it's a hope for patients, and it's hope for families. I also think it's hope for the staff who work in the NHS, Mr Deputy Speaker. Our report noted that the pressures on the workforce were having a real human impact, and are having a real human impact on the people involved in working in the service. It pointed to the fact that in August 21 alone, the NHS lost 2 million full-time equivalent days to sickness, including more than 500,000 days to anxiety, to stress, to depression, and other mental disorders. And Adam Kay, who has spoken very movingly about his decision to leave medicine and his writing since, spoke very powerfully about that at the Select Committee yesterday, and I would refer the House to the Hansard from that transcript if anybody's interested. So talk of burnout has become commonplace, I think, and aside from the obvious human impact, the result of that burnout is a massive problem with an impact, therefore, on retention, which is then a vicious circle and increases the pressure on those who remain working in the service. So people can now see the hope part of what I'm saying, that the cavalry is coming over the hill. There is a plan. And that in itself, I think that can make a difference. And I think that the pay settlement today, along with the pension announcement in the budget and this long-term workforce plan, should be seen as a package of measures, which I hope gives some hope to the workforce that there are better times ahead.
Would you go away?
Yes.
I'm alarmed, as he is, about the 9.1% annual loss of staff, because that is a very high loss rate by any normal standard, and implies that there's something wrong with the jobs or the leadership. And so does he and the committee think a lot more work needs to be done on job descriptions, job feasibilities, support for people in their roles, so that these jobs are perceived to be a greater value for people, so that they don't want to leave, because otherwise we have the extra cost of training somebody new?
Yes, and I was... There is a part of the workforce plan that talks about every year, every member of staff should have a conversation with their employers about their pension arrangements, about their health and mental health and well-being. And I think that's fantastic. We discussed this a little bit yesterday in the Select Committee. I think it's fantastic. I am sceptical as to how that is remotely possible in an organisation of this size. It doesn't mean that I don't think the ambition is right. Of course, I think it is right. But you know, if the Minister wishes to touch on that in her wind-up, I think that would be helpful to the House. And the other point that I would say to my honourable friend from Wokingham is that, and I will say this a bit later in the speech as well, is that you have to remember that the government, of course, there are NHS employers, and ultimately, I suppose, the government is the employer. In the widest possible sense, but the actual direct employer are trusts when it comes to hospitals, and actually they have a big role to play in retention. They have a big role to play in workforce health and well-being, and I think sometimes we duck away from saying that, and I say that here in the House, I say it privately to the Chief Executive of my trust. So to move on, I'm very encouraged by the emphasis the workforce plan places on prevention, which everybody knows is one of my great passions in life and politics. It's clearly going to be crucial given the supply and the demand challenges facing the health service at the moment. Prevention is, as colleagues know, a subject dear to and close to the work of this Select Committee. We've launched a major inquiry into the prevention of ill health. We have 10 work streams. We've already done the vaccination work stream, and we've now moved on to the healthy places, home and work stream, and details of that are available on our website. Let me turn to Mr. Deputy Speaker, some of the specifics in the committee report, and look at what action the government has taken. So one of our key recommendations was that the number of medical school places in the UK should be increased by 5,000, from 9,500 to around 14,500. The plan does that. It doubles medical school training places in England to 15,000 by 2031-32, which is extremely welcome. As I said to the Prime Minister last week at the Liaison Committee, I hope it might be possible to make some of these new places available before what it says in the plan, which is September 2025. But just to finish this sentence, but I would add, with a UCAS deadline of mid-October for September 2024 start, that looks extremely challenging. So it's something we discussed yesterday at the Select Committee. An update from the Minister on that would be welcome as well. I want to give way to Worcester.
Very grateful to my honourable friend, and I congratulate him on the report he is presenting. On this issue of making places available, would he agree that the report talks about the 2018 to 20 cohort of universities and the great success of those new university medical schools, and the government's response echoes that. Those university medical schools which have been approved by the GMC since are currently in the situation of having no funded places. They are open, they are receiving students. Would he agree it would be very welcome if on that quicker deadline that he has challenged on, there were some funded places available to those 3 new medical schools?
Yeah, and I thank the Chair of the Education Committee who guested on our session yesterday with the Medical Director of NHS England on our workforce special. He's right. So the government response, certainly the Prime Minister said to me at liaison, and the Medical Director said yesterday, is that it's going to take time to scale up. The GMC Chief Executive, who was before us yesterday, talked about training capacity in scaling up these medical places. That is, of course, right. That is, of course, going to need to be done. But where the medical schools are ready and could move, even with fairly modest numbers for September 24, I think it would be an incredibly good signal of intent from the government to allow them to start in September 24. And I think the money is front-loaded, and therefore I think the fiscal cycle should allow that to happen. And if I know my honourable friend well, I know that he will not be letting this one go. So thank you for raising it, and I give way to
I can see why there may be difficulties in speeding up between 22 and 25, although like the other contributors so far, I would urge the government to do all they can. But it's also the case that much faster progress is expected 28 to 31 than 25 to 28, and I would have thought it would be possible to bring some of that forward, which would be welcome for future managers of the NHS.
Yeah, and I see no reason. I see no reason why not. I mean, I'm always open to argument from the government benches, but in so many parts of our workforce economy, there is a shortage of people wanting to do certain roles. This is not the case in people wanting to go to medical school. I'm constantly contacted by people from around the country, and certainly people from my area in Winchester and Chandler's Ford, where there are many children, often of already serving medics, who are straight A students who want to go to medical school, who can't because the places aren't there. So we've made the mental leap to put the places there. I think bringing them forward must be possible, and the Minister knows that we're on the case with this one, and I placed that challenge before her today. On the subject of then medical degrees, the plan also talks about NHS England working with the GMC, and I said we heard from Charlie Massey, Chief Executive, yesterday, to consult on introducing 4-year medical degrees. So again, the idea of shortening training periods is something that the committee explored in its original report, Mr Deputy Speaker, although principally I think that was in the context of postgraduate training, but I fully support. And we currently take international graduates from all over the world with much shorter undergraduate training programmes than we have here in the UK. So as long as the GMC standards are met, I'm very supportive of shortening the medical degrees. I've spoken directly and on the record to the Chief Executive of GMC about it. Obviously, quality and safety have got to be paramount, but as long as they are satisfied with their medical licensing certificates that they will be issuing, then I really think we should embrace that. And please see it in the report. I'm also encouraged by the emphasis the plan places on apprenticeships, with a commitment to providing 22% of all training for clinical staff through apprenticeship routes by 2031-32. That's up from just 7% today. In our related report, Mr Deputy Speaker, on the future of general practice, because everything comes back to workforce, we call for the government to provide the funding necessary to create 1,000 additional GP training places each year. The plan pledges to increase the number of GP training by 50%, to 6,000 by 31-32. So, box ticked, win, thank you. We also called in our workforce report for reforms to the NHS pension scheme to prevent senior staff from reducing their hours and retiring early from the NHS, and again, win. The government has listened to the committee. Obviously that was announced in the spring budget this year. I think that's incredibly welcome. It was the #1 ask of the BMA, and we responded, something I hope they will remember over coming days. And I hope it's something the opposition will come round to support as well. Maybe when the opposition spokesman has her say today, she might reflect on changes to pensions in the budget, because it has been very welcomed across the health sector. The plan also makes it clear that NHS England will work with government to deliver actions to modernise this NHS pension scheme. There's a specific section there about that, and the department will introduce reforms to the legacy pensions scheme so staff can partially retire or return to work more easily. I think this will make a big difference to some staff, including those like the consultant reconstructive surgeon who gave evidence to our original inquiry. He described the retirement happening, quote, almost against his will as a result of pension taxes, and said the NHS was, and I quote, hemorrhaging senior staff over pension concerns. So I'm really pleased this is being addressed, and I meet 2 or 3 times a year with the presidents of all the Royal Colleges in my role as Chair of the Select Committee, Mr Deputy Speaker, and I did wonder if it might take a while for the announcement in spring budget to feed through. And actually, I understand within weeks of that announcement being made, a number of them were reporting to me, because I directly asked them this, that it had already moved the dial in people making different decisions about leaving service. So I think that's a good one. When it comes to retention, I think the train bit of the report is incredibly strong, and I've given some examples. When it comes to retention, I think the report is, could do better, as they say in my school reports. So we recommended there should be a review of flexible working arrangements in all trusts, with a view to ensuring that all NHS staff have similar flexibilities in their working arrangements to those employed by locum or agency staff. And the plan does talk about a renewed focus on retention with improved flexible working options. And although there's clearly a lot of detail still to come, I was pleased to see that on this point the government is listening to our committee, but I think we still need quite a bit more detail on that and how that ties in with the childcare changes, for instance, that were announced recently in the budget. Yeah.
I'm grateful to the Honourable Member for giving away again. I couldn't agree with him more on this point about retention. You know, we do hear a lot about recruitment, but fundamentally you can't recruit your way out of a retention crisis, and that is what we have right across the NHS workforce. Would he agree with me that we need to have measures for retention very urgently in the sphere of GPs and general practice? Because at the moment we've got, the government says quite rightly that it's recruiting more GPs than ever before, but we've got a bit of a one in, one out situation where the bucket is very leaky, and for every GP we're recruiting, another one leaves. So actually we need retention measures right across the board, but very specifically in general practice, if we are to recruit more GPs to fix the front door to the NHS.
Yes. One witness to our session yesterday said that the tap is well and truly on, but the plug is still half out, and I think that's a very good way of putting it. So the recovery plan for primary care that was obviously published a few months ago is really strong. I think it's really positive. I think it's talking about those wider primary care roles. I think it's being created in conjunction with, for instance, the Royal College of General Practice, and we need to see fast-paced rollout of that plan. We need to see the extra money for community pharmacies move through the contract fast, so that it moves the dial even faster, because it is critical to retention of general practice staff, but it is also critical to this winter being better than last. So yeah, point taken. One other important thing to note about the plan, workforce plan, is that it is iterative, so it will be refreshed every 2 years. I guess there are 2 ways of looking at this, and I would appreciate maybe the Minister's comments, is that I understand that it was the Treasury's insistence that it is looked at every 2 years. This is fine. But you could look at it 2 ways, couldn't you? You could look at it that the Treasury want to make sure that, that the plan is ambitious enough, and if necessary, more ambitious, so that it can put more funding behind its next iteration, or you could look at it the other way, the half-empty way, and say that the Treasury may wish to trim back. It's very, very important that the department, ministers and this House make sure that it is the former. So the iterative side of the plan is important. And while we're still in the early stages, I think it's important that the plan starts to deliver quickly in a practical way for people on the ground, which is why I say what I say about working with the primary care plan. One of the possible risks to delivery, and there are a few, because obviously there are big assumptions in the plan, there are models in the plan around numbers, is the plan is based on a pretty ambitious labour productivity assumption of of up to 2%, 1.5% to 2%. I think it may even have been the lady on the front bench for the opposition who raised this in the statement when this plan was put forward, but certainly somebody did on those benches, that the NHS has struggled to achieve that kind of productivity gear change in the past. So achieving it now is going to be a challenge. It doesn't mean that it's not the right thing to do, but I just would like to understand as we go forward, necessarily not today, from the government as to what happens to the projections in the plan if that productivity assessment is not achieved. On this, yes?
Further intervention on that point, what assessment has he and the committee made about the iterative process and the Treasury's assumptions, building in an ageing workforce, and secondly, the acute nature of mental health needs amongst the younger population?
Well, we haven't yet, but I merely put down as a marker today that I hope that it is a review process so that we can be even more ambitious and see whether some of these risks, if you were to write a risk assessment to the risk register to the plan, I would suggest that one part of the risk register could be this productivity challenge, which the NHS has long since struggled with. Let me turn, before I close, to social care, Mr. Deputy Speaker, because here the picture is in many ways more challenging. So the committee's report notes Care England's finding that in December 21, 95% of care providers were struggling to recruit staff, 75% were struggling to retain their existing. It concluded, and I quote, that care workers often find themselves in underpaid roles which do not reflect the value to society of the service they provide. Now, our report noted that without the creation of meaningful professional development structures and better contracts with improved pay and training, social care will remain a career with limited attraction, not poor attraction, because many people do want to do it, even when it is so desperately needed. I know the Minister's passionate about this, and I know she will give a passionate response to it today. But we noted that health and social care services are, obviously, they are interdependent. And if efforts in the plan to tackle the current challenges in the NHS are going to be successful, then capacity needs to increase across both health and care. The Minister knows this, but I feel I have to say it. And that point is absolutely crucial, Mr. Deputy Speaker, and with the welcome focus on the NHS workforce, it's vital that the issues affecting the care workforce are not forgotten, because the NHS workforce plan can't succeed if the challenges facing the social care workforce are not tackled. I was visiting HC1 Care Home in my constituency last month during Care Home Week, and I met a very interesting lady from the Prince's Trust who is working with that care home group on the pipeline of staff working in social care, and I would recommend the government to be in touch with the Prince's Trust. I think they're doing good work in trying to inspire people, young people, to go into a career in care. And I accept, of course, that it's a different kind of workforce. I accept that not all the levers are in the government's control, as I said in the intervention exchange a little bit earlier. But the government knows that there's much to do on this. So to conclude, Mr. Deputy Speaker, the 75th anniversary is a huge milestone, clearly, for the NHS. It's an organisation that millions of people still have huge affection for, but I think to misplace that and to take it for granted would be to do the very opposite of serve the NHS faithfully. The anniversary can't be an exercise in nostalgia. It must be an opportunity to look forward and to make sure we've got an NHS that works for our constituents now and in the decades to come, that is a prevention service as much as it is a sickness service, that looks after its staff among the best organisations in the country, public or private sector. I am very optimistic about the workforce plan. It's a big step in the right direction. The fact that it's out there is a big moment, but there's plenty still to be done, and the Minister knows, Mr. Deputy Speaker, my committee will be right there scrutinising that work as it's taken forward. The plan is just the start. Thank you very much.